Hey guys, what's going on? It's Dr. J.
It is Dr. I, and it is La Madre de Dr. I and Dr. J, and this is Second Opinion with the Twin Doctors. Doctor, what am I going to say?
What's in the news?
Give me the news, Doctor.
What's in the news is frozen eggs. Now, we're not talking about frozen chicken eggs. We're talking about frozen human eggs. There was a study done in the Middle East recently that found that it's not your age when you conceive that affects how likely you are to have a successful pregnancy if you're a woman. It's the age of your eggs. And what they found was if people freeze their eggs before the age of 35, there's a 50% chance that those eggs will lead to a successful pregnancy. If they freeze the eggs between 35 and 40, only a 33% chance. And if they freeze the eggs after 40, that chance drops to 20%. So, moral of the story, doesn't necessarily matter your age when you want to conceive, ladies. It matters the age of your eggs. And that is what's in the news. Now, on to our main topic of the day. From baby bumps to burp me, your guide to pregnancy and parenthood. And we've got amazing guests today. We've got two obstetricians. These guys right here. Okay. We've got a lady who birthed two obstetricians. We've got a couple of amazing.
To be fair, we weren't obstetricians when she birthed us.
Well, I think we were. We were the world's youngest obstetricians.
Okay, all right.
We've got two amazing pediatricians. We've even got a chef. Now, why does all of that matter? Well, we want to help people feel more comfortable with the prospect of being parents. Why? Well, a couple of reasons. We're going to give you some stats. Number one, people are waiting. Well, first of all, people are not even having babies as much as they once did. There is research that now shows that people are having babies quite a bit less than they once did. But it's not just that they're having babies less, they're waiting longer to have babies. 50 years ago, people were having their first baby around the age of 22. Now, most people, 27, 28. Why? Probably a lot of reasons, but there was this survey done with Mutual of Omaha recently that found that basically people said that the prospect of becoming a parent,
They're scared.
They're scarred. It makes them feel overwhelmed and anxious. Well, we don't want you guys to feel overwhelmed. We don't want you to feel anxious. And so we're here to give you guys pointers on pregnancy and parenthood. First, we're going to start with pregnancy because there are two obstetricians on this stage.
And somebody told me we wrote a book about it. Did we?
We did. We wrote a book. It's called Everything You Ever Wanted to Know About Pregnancy, but we're too embarrassed to ask.
Yes, we did.
So let's help people first with some pregnancy pointers. Number one, Dr. I, take it away.
Regular prenatal care.
Yes,
Now,
yes.
we need to see it because we got to pay bills.
Yes,
right?
we do.
But more importantly, people that get prenatal care regularly suffer from a lot fewer pregnancy complications, less preterm labor, less premature rupture of membranes, less preeclampsia. So get prenatal care, get it early, and get it often, as they say.
Yeah, now I've got a question for you, Ma. How far along were you when you started to get prenatal care?
I was probably actually about a month along. The tests were not as sensitive as they are now. You had to wait a while. I knew, but
Now, how did you know?
because I was so regular that I would get my period in the same psychology class.
I'm sure they appreciated that.
I would have to, well, everybody knew because I would have to leave class and come back in, but yeah, it didn't happen. I felt like it was going to happen, but it didn't happen.
So you knew early that you were
thought,
pregnant.
yeah.
And so you got prenatal care early, okay.
Yeah.
Good mom, and look what happened.
I did.
We're doctors, so it worked, Okay, so.
Enough said.
Enough said, exactly. Okay, so get prenatal care, that's the first thing. Second thing, make sure that you're taking prenatal vitamins. It seems simple, right? But taking prenatal vitamins is super important. Taking prenatal vitamins, again, helps to ensure a healthy pregnancy. Now, we encourage prenatal vitamins, number one, but we always say make sure that the prenatal vitamins have DHA in them.
Yep.
DHA helps to ensure that the baby's brain develops properly, like ours. It also helps with the vision. I don't know about that part.
Yeah, I was going to say.
But
You didn't take DHA, did you?
I did not.
I'm blind as a bat.
Yeah, but it theoretically helps with the vision. We also tell people make sure that your prenatal vitamin has folic acid. Now, this is some inside baseball for you guys, right? Folic acid is important, at least 400 micrograms per day. But we encourage that you take L-methylfolate, and not a lot of folks are talking about that. Why? Folic acid is basically, it's a chemical. It's a synthetic form of this B vitamin. L-methylfolate is a natural form that your body absorbs more readily. And the last thing, vitamin D. Everybody's vitamin D deficient. So you should be taking between 2,000 to 5,000 international units of vitamin D a day. Helps to decrease the risk of high blood pressure, helps to decrease the likelihood of low birth weight. So prenatal vitamins, yes, but L-methylfolate, vitamin D.
So I gotta ask you, Mama, what did you do to prepare for a healthy pregnancy? Or were we
And I think he's asking this question because we normally tell people take prenatal vitamins before you conceive.
Exactly.
If you are trying to conceive. So
what did
Well,
you do?
obviously,
What did you do
that
in
wouldn't have been a
preparation?
thing for me because it was an accident.
wait.
Wow.
I
Okay,
didn't- no, not
breaking
an
news. We were
accident,
unwanted. We
not
were
an-
unwanted.
Oh, you were very much wanted. But I did not plan to become pregnant then. Your father
God rest his soul.
planned that I should become pregnant then. Little sabotage there.
Little
The
proactive
old
sabotage.
diaphragm, yeah.
Okay. So basically, we were two big mistakes.
No, not at all.
So
I
you're
was
too-
very excited once I settled in with the idea that
Once the
my
depression passed.
Well, yeah, no, there was no depression. It was fear and shock.
Fair enough. Okay.
Also, you got to maintain a balanced diet,
Yeah,
right? You got to maintain
absolutely.
a balanced diet. 60% from carbs, 20% from healthy fats, 20% from proteins. Now, when we're talking about carbs, we're not talking about like ding
We're not talking about ding dongs,
ho-hos, things like that.
We're talking about healthy carbs. So
Yes.
what are we talking about? We're talking about fruits. We're talking about veggies, things of that nature. And when we're talking about fats, we're talking about healthy fats.
Yes.
Avocados, salmon,
Salmon, yeah.
nuts, things like that. But healthy diet, super important. The fourth thing, and well, I want to know this though. I want to know this, Ma. Okay, so I feel like now we really push the whole diet thing. But you know, almost you were
I
pregnant
was
with
back
us.
in the early 90s when you were pregnant with us.
Yeah.
Back in the early
Yeah,
90s.
no.
More like the mid
The
70s.
70s.
The mid 70s. Did doctors really push healthy diet, or was it more a matter of, hey, you're pregnant, eat for two, and engage your cravings?
They did to some extent. They would ask you what you normally ate, and I'm assuming since I'm a healthy eater, that was good. But yeah, they didn't have prenatal vitamins, so I was taking my normal natural vitamins.
And you were eating healthily the whole
I
time.
was,
the
of
whole
course, I
time.
was. I
No
really
cravings,
was.
nothing whatsoever.
Well, I think waffles are quite healthy.
Whole grain waffles?
No.
Okay, all right.
They didn't have whole grain waffles.
You were eating so many waffles that our dad said we were going to be born with those little squares in our
Yes,
skin,
he
right?
did.
Okay,
He
so I think you
definitely
had a
did.
waffle problem, Mama. Okay, all right, but healthy diet.
This is an intervention. 4 years late.
I still have a waffle problem. I love them.
Fourth thing we always say.
You
we
gotta
say
stay active.
You have to stay active.
Yes.
At least 150 minutes of moderate exercise per week. So what does that mean, moderate exercise? Walking, swimming, yoga, things of that nature. Now,
I'm afraid to even ask. Did you stay active when you were pregnant with
I
us?
did. I
Did you?
love to walk.
Okay.
And you know, we lived right by, well, we were in a rural area.
Yeah.
We were in Bourbonnais, Illinois, so we had a cornfield in back with a lovely path beside it.
All right.
And we had a little dog
Seth.
that needed, Seth, that needed to be walked. So,
Okay. And then what about those harmful substances, right? So we always tell folks, it seems common sense, but avoid these harmful substances. We're talking about alcohol, we're talking about tobacco, we're talking about smoking, things that work, chemicals, pesticides,
Heavy
things of that
metals.
nature, heavy metals.
so
I'm
so,
afraid to ask.
Yeah, I was going to say I'm afraid to ask. Because again, the 70s were a different day and age,
I
right?
know.
And so people smoked, they drank,
did,
they
they
used
drank.
drugs hardcore. And so did doctors, would you see pregnant women like in the 70s who were still drinking and smoking and using drugs? And more importantly,
Were you?
Were you? Yes, when did you stop drinking, smoking, and using drugs, Mother?
I didn't do any of that. And you wouldn't see, well, I didn't see in my peer group any alcohol use hardly. But there was some smoking going on.
By whom dare I ask?
Not cigarettes.
I didn't think so. I guess I'm asking, were you doing that?
No.
Thank you. Thank you.
No.
Well, so those are 5 healthy pointers for having a healthy pregnancy. But I think that, we were talking earlier about how the fact is that most people feel anxious and overwhelmed by the prospect of having a baby.
Right.
And it's not necessarily the pregnancy that they worry about. I think people worry about that. But what people really tend to worry about is the 18 to 21, maybe 23 years after that. And more
If you're
importantly,
lucky.
I'm going on
If you're
26, but
lucky.
anyway.
if you're lucky. And I think in particular, they worry about bringing home that newborn. You've got this new, vulnerable life. There's no owner's manual, and you don't know what to do about it. Well, we're going to tell you guys what to do about it. Well,
So
we're
there
not
is an
going to
owner's
tell you.
manual. Sounds like there is an owner's manual. Is that what you're going to tell us?
There sort of is an owner's
Kind
manual.
of,
So
yeah.
we've got an amazing guest coming on, Dr. Gabrielle Dower. She is a doubly board certified pediatrician, and she is also the author of a book, and I want to make sure I get this right, Beyond the Basics, a Pediatrician's Newborn Guide.
AKA the owner's manual.
Exactly, that is the owner's manual. So we're going to bring her on next to help dispel some myths and to help make prospective parents feel a little bit more comfortable about the prospect of bringing home that newborn. All right, guys, so we opened the show talking about some stats that indicate that people are feeling somewhat overwhelmed and anxious about the thought of becoming parents, and it's understandable why. So we've got, like we said, like we teased, we've got an amazing guest with us, Dr. Dower. She's a board-certified pediatrician, but if you check out her socials, and I've been all over her socials, she has so many amazing tips for parents of all ages, or for parents of children of all ages, but especially the newborn. So first of all, we want to welcome you. Thank you for coming.
Thank you for having me. I'm so excited.
Absolutely, absolutely. So, my first question is kind of a very general question, but we were teasing how there was a survey done recently that found that basically 50% of people who are thinking of having kids just feel overwhelmed by that prospect, by that thought. You're both a doctor, a pediatrician, but also you're a parent. So, do you think that prospective parents should feel overwhelmed or anxious by the prospect of becoming parents? She laughed.
I think that so much of it can be mitigated by having conversations with your pediatrician, with your OBGYNs, because I think the fear is of the unknown, right? Like, what do I expect for feeding? What do I expect for changing? When you don't know what to expect, it creates and generates this fear in parents. And I think that it's the unknown. Once you get into the swing of things, after a month of doing things day to day, you and baby will get on a schedule. You and baby will get, to a little jive. And it becomes a little bit easier. Am I learning something new every day as a parent? Absolutely. But I think that the fear is in the unknown. So having the conversations, reading the books, even parents in the nursery who are fifth-time parents are a little nervous getting started again because you forget the process.
Yeah, and I have to say, I was relatively young. I was 22 when my oldest son was born. And so I was the first parent, and Jamil didn't have kids, and none of my friends had kids. And so my wife and I were saying, it was kind of like a reality call. Wake up call. Having kids is great, but it is stressful, it is frightening, there's so much. And we were saying at the time, and granted this was in the 90s, but we were saying at the time, I don't feel like people talk about this enough. People just say, oh, it's great, you're gonna love your kid and that's it, And we didn't really get enough information about kind of what it's like day to day. And so I agree, I think having that information makes it so much easier for people to know what to expect and to feel comfortable with the ups and downs they're gonna go through.
Yeah, 100%. And I think one thing that makes people nervous is just the thought of bringing home this newborn. They're vulnerable, they're completely dependent upon you, and like you said, no one necessarily tells you what you should and shouldn't be doing, right? So I guess one thing that people always wonder about is just getting the home ready for the newborn. Are there any important steps that you would recommend people take when they're trying to get the home ready, to kind of baby-proof the home?
Absolutely. So when you're thinking about, baby proofing, we don't think about baby proofing until baby is a little bit more mobile, once they actually start moving around. But you want to make sure that that home is safe for you and your baby. So you're still going to be doing things early. You're going to anchor all those, large furniture pieces that could potentially tip over, including baby's changing station, because yes, even a newborn can flip off their changing table. Making sure that the water heater temp is capped at 118, 119, removing any long cords that could be attached to lamps, anything you could trip over. Making sure that your stairs are secure. You'd be shocked as to how many exhausted parents who are carrying babies up and down the stairs, can fall, can drop baby, making sure that you have the most secure staircase, making sure that anything that's breakable is out of the way. Obviously, much more to come when baby's mobile. With respect to what you should have in the home, you can really get everything from Target, Amazon so quickly. Have the basics, have what you need to feed baby, what you need to change baby, and a safe sleeping space for baby.
Yeah. And my next question was going to be about SIDS. I remember, and my mom always teases me when I had with Adam. Adam is my oldest. I was paranoid when it came to SIDS, right? And I think all parents are afraid, right? Because it's such an unknown. And so I would always be standing there looking like, is he breathing? Is he breathing? Is he breathing? My mother's like, stop it, you're going insane. But what is SIDS, and what are the ABCs of SIDS prevention?
Absolutely. So SIDS is sudden infant death syndrome, and now it's more commonly known as SUID or SUDI, which is sudden unexpected death of the infant. And this is a sleep-related death where baby passes away in their sleep environment. And it is associated with baby being prone and with the airway being compromised, but also associated with things that are in that sleep environment. So any blankets, any pillows, that's why we use the mnemonic for safe sleep, ABCs. Baby should be alone. A, B, there should be nothing there except for that baby on their back in that crib. ABC, alone, on their back, in that crib or that bassinet. And there has been a lot of data since 1992 that putting babies back to sleep has reduced SIDS and SUDI. I have seen in the last 10 years, I mean, I'm not talking about one, I've seen 7 or 8 babies who have succumbed to SIDS, so I understand that fear, and making sure that you put them in an ideal, safe sleep environment is the best thing that you can do as a parent.
And so you had mentioned having babies sleeping on their back, and it's funny because we were talking to our mom about that earlier, and we were asking her about what SIDS education was like when we were kids, and I don't think there really was much.
Not really.
Yeah, and instead of having babies sleep on their backs, you were encouraged to have babies, to have us sleeping on our stomach.
Yes.
Yeah, now what was the whole thought process there, if you remember?
For me, it made perfect sense because if you threw up, and babies do a lot of that at a certain age, you wouldn't aspirate it.
Yeah.
So, to me, that made perfect sense.
Yeah.
And you guys were secure because you were in kind of a fetal position. Their little butts in the air, but you didn't jar yourselves awake,
Yeah.
with these sudden movements. So I was pretty shocked to find out that, wow,
Yeah.
I'm
You were
lucky
doing it all
you
wrong.
survived.
Yeah. Yeah. So having kids on their backs, and so you mentioned having a safe sleeping environment for them as well. And so when I hear that, I think about things like the bumpers and the pillows and things of that nature.
Stuffed animals
Stuffed
in
animals.
the
Yeah.
bed with them.
Yeah. I mean, so do you recommend that parents avoid using the bumpers and the pillows and the covers and the stuffed animals, or is there a certain way that you can use them that's a little bit safer?
Absolutely. There should be nothing in that safe sleep space, nothing in their bassinet, nothing in their crib. If you remember, those little tiny babies, they have that grasp reflex, and they have that for about the first 3 months. So that means that when they're grabbing your finger and it's nice and cute, they can easily grab anything that's loose in their bed and pull it over themselves. And also with that moral reflex that they have for the first few months, they can move things around. So we don't give babies enough credit. But if they have anything in their bed, they can absolutely grab it. So I tell parents, decorate the room, decorate their space, but leave that baby sleep space nice and clear. People are gifting blankets, people are gifting teddy bears. Take that off of your registry, put the stuff you need, put extra packs of diapers, put the breastfeeding essentials. We can skip the blankets for now. One cute blanket's fine, just not in the crib.
I was going to ask about co-sleeping because this is a thing. So I've got 5 kids. My oldest is 26, my youngest is 11. And I absolutely love, even now, come on, we'll have a family bed. I love the family
The
bed.
26-year-old still co-sleeping.
Not the 26-year-old. His girlfriend was like, no, she's not co-sleeping. So they're out of the picture now. But, and so I remember, again, I was very young. I was a first-year med student, very sleep deprived and probably a little bit stupid. But I was co-sleeping with my infant. He was probably no more than 2 months old, right? And so I was super tired, and my wife kind of woke me up, but not trying to jar me because I had him in my arm, and he was over the floor, which was a cement floor, so she didn't want me to jump. And so as much as people may love co-sleeping, and I do with my older children, is co-sleeping safe? What do you think about co-sleeping?
So that's a great question. So co-bedding, I sleep with my kids. My kids are 6 and 3, especially when dad is on call. Come on in, come into the bed, and that's fine. But co-sleeping with an infant, being in the same physical sleep space as an infant can lead to suffocation. So how do we do this safely, right? So I typically recommend we're not going to be co-sleeping. I want baby to have their own safe sleep space, especially for that first year of life. And what I want parents to know is that, maybe they will fall asleep while nursing. Maybe they will fall asleep while feeding. And what that means is I want a plan in place. So what I talk about is safe co-bedding. And what does that mean? There's a safer way for a parent, usually a nursing mother and a feeding parent, who can be with baby on the mattress. That is not baby in between 2 parents on a fluffy mattress with pillows and blankets. That's a mattress on the floor with a tightly fitted sheet, just the feeding parent and the baby alone, no blankets, no pillows, nothing extra. So, we plan for the situations where parents might co-bed, and we talk about the reality of how hard it is to feed and constantly feed baby overnight. and how to safely do that co-bedding if parents are going to choose to go that route.
I want to ask, sorry, one quick question about the side sleep.
I literally was going to ask about
when I had my last, we were almost 40, so I was tired for another reason. And so, the side sleep was like, okay, we're not going to have the baby in the bed, but baby's like right there. And so it's convenient, but I would think for all the reasons you shouldn't have them in the bed with you, the side sleep is probably not a great idea either. But what do you think of the side sleeper?
Right, so I had like a little bassinet right next to my bed, so it was a physically different sleep space because you never know. Like, we're exhausted. I just had a mom in the nursery who fell asleep and dropped baby when she was breastfeeding. Like, you are just exhausted. So you're not going to notice those little safety differences. That little side sleeper can separate from the bed and baby can move in between that space. I would have like a little bassinet next to you where you can pull the side down easily and have that next to the bed. That would be my best recommendation.
Interesting. So that's kind of a nice segue to breastfeeding, actually. Not a nice story, but a nice segue. So, we obviously encourage breastfeeding. We have these breastfeeding friendly initiatives. Try and say that 3 times and you'll sleep deprived. But we're really pushing breastfeeding. And one thing that I find happens with a lot of the new moms especially is they worry, is the baby getting enough breast milk? Obviously, if you're using a bottle, you can measure how much the baby's gotten. But if you're strictly breastfeeding, you don't know. And that tends to create a lot of anxiety among the moms. And frequently they say, should I supplement? Should I supplement? Should I supplement? What do you tell parents to look for when they're trying to decide whether or not the baby has actually gotten what they need when they're strictly breastfeeding?
That's a great question. I get this question all the time. And the biggest things that we look for are urine output, how much the baby's peeing, and also how much the baby weighs. I start this conversation with mothers because I have 2 kids and I went through this process with the fact that breastfeeding is not easy for everyone. People don't talk about how hard it can truly be, mother to mother, baby to baby. Every mother-baby dyad is different. So we start with that. Our expectations, let's drop them a little. Let's work together on how we're going to feed this baby. But knowing how much you're giving in those first few days, we typically only make a few drops of colostrum. It's liquid gold. It's absolutely incredible for baby, but it's not much, and we're not pumping, so we don't know how much we're giving to baby. So something that I do is I set baselines for parents. So I say, day 1, I want your baby to pee 1 time. On day 2 of life, 2 times. Day 3 of life, 3 times. And it'll increase by day, so that by 6 to 8 days, they're peeing about 6 to 8 times in a 24-hour period. So if they're at least urinating at that point, they're hydrated from that standpoint. Something that your doctor is going to be looking for is how much baby weighs. Now, every baby's going to drop weight when they're first born. They live in an environment full of water. That water is going to evaporate. They're going to have large bowel movements, but they should pick up that baby weight by 2 weeks, and they shouldn't lose more than 10%. So when it comes to when should we supplement, if baby's getting dehydrated and they're not urinating as they should be, or if you see that baby's dropping more than 10%, that's definitely time to talk to your doctor about either pumping or providing some sort of other hydration for your baby.
Okay. And I want to ask something along those lines. So I'm probably going to have DCFS called on me. Like, I'm just admitting all the horrible parenting, but I was young. It was my first baby, and he's 26. He's okay. But when it comes to feeding your baby, and I'm sure every baby's different, but what are some rough guidelines? So I remember I told my mom, like, Adam, he's just crying all the time. Like, he won't stop crying. What's wrong with him? And we were feeding him. She's like, you're only giving like 2 ounces of, or whatever we're giving. I don't remember how many ounces. She's like, this poor baby's starving, And so we gave him more, and lo and behold, he was happier. So what are some rough guidelines for how much a baby should be drinking every 2 hours, 4 hours at a month versus 2 months versus 3 months, just for people like me who may be a little slow on the uptake?
It's so different for every baby. So when they're first born, if they're latching and nursing on mom, some babies take 15 minutes, some babies take 20, and then there's the babies that will sit on mom for an hour. Those are the babies who they start with a really good nutritive suck, and then they'll start to kind of give you that non-nutritive suck because of comfort. So when mom is nursing, it's really hard to know amounts, right? But if we're talking about amounts in a bottle, for our formula-fed babies or for pumped milk, we say 20 to 30 milliliters or cc's every 2 to 3 hours for our brand new babies who are just out. And we follow their cues because you're right, some of these babies are starving. So we will give them 30, which is half that bottle. You know, those little 2-ounce pre-made bottles in the hospital, we'll give them half. We'll pull the bottle out, see how baby's doing, see if they're nice and calm, and if they want more and they're giving that rooting sign of looking left and right, trying to put their hand into their mouth, you can give them another 10 to 15 cc's and go by their cues. That's for babies, for brand new babies, and we pace the feed that way. Once they're a little bit bigger, so let's say they get to 1 month, they're going to be eating closer to 3 to 4 ounces every 3 to 4 hours. Sometimes it'll vary. They eat a little bit more, they eat a little bit less, but mother's milk is incredible. Both of my kids would take 4 ounces per bottle, and that's it. They never took more than like 4.5 ounces because mother's milk changes in consistency and calories. So really, we don't have to increase the volume. Our calories change, our consistency changes in breast milk. So as long as you hit that like 4.5 hour mark, babies will tell you if they're hungry every 2 hours, every 4 hours. When we overfeed our babies, it can lead to reflux, and also it can lead to some disappointment when mom can't make that much milk, right? So lots of conversations to have about how much babies should feed. Follow their cues.
Beautiful. Now I've got a question about, and this is one that a lot of people don't think about, I think, until they actually have the baby, but it's the little umbilical cord stump. We've got so many patients who come in and they're like, what do I do with this thing? Do I pull it off? Do I dry it out with alcohol? Do I clean it? You know, they're like so intimidated by it. What do you recommend that people do with these little umbilical cord stumps?
Right, so the stump, so when baby comes out, that's their connection to you, to mom, for their continuous food, nutrition. So when baby comes out, that cord will be cut and you will see a little clip put on it by the nursing team. That clip will stay on during their hospital stay, and before you go home, that clip comes off. So what you're left with is a little dry umbilical stump. And that, my rule with it, don't touch it. Just leave it alone, because somebody in your family is gonna say, put alcohol on it, put a cream on it, it looks dry. I do not want you manipulating this area at all, because the more that you touch it and manipulate it, it can actually get infected. Now remember, it was an opening from baby's body to your body. I don't want you touching it. Most will fall off around day 7 to 10, some a little earlier, some a little bit later. So if you see any redness, any swelling, any pus, you absolutely have to let the pediatrician know, because it can be an infection. Don't touch the stump. That's my number one rule.
I've got one final question for you, and it's a bit of a leap, right? But we've got a guest coming on who's actually pregnant with triplets. So what advice do you have for new parents bringing home multiples?
Oh, I mean, it's beautiful. My husband is an identical twin, and like seeing our families now with all the cousins, it's so lovely. But you know, the biggest thing is be patient, be kind to yourself. You know, as mothers, we're the meanest to ourselves, right? We're our biggest bully. Be kind to yourself, to your body. One baby is hard enough. Having multiples means that we're not setting any extra goals for our days. You know, get babies fed, basic necessities, fed, changed, loved, and ask for help and accept it. I think our hardest thing is accepting help. When you have multiple babies and help is offered to you, accept it, because you know, feeding multiples can be tricky, especially if you're exclusively breastfeeding multiples. It can be really, really hard to produce that much milk. I mean, I could barely exclusively breastfeed one child at a time. So like, take it easy on yourself. Find a community of people around you who are also parents of multiples, who have been through this path before. I think that's a great start for parents of expecting multiples.
I think that's good advice. And I tell that to all my patients, like, accept help. Women are warriors, and it's like, take a breath, accept the help.
Well, there was so much more we wanted to get to, but we're running out of time. So I want to ask you, where can people find you? And I was going to say more importantly, but just as importantly, where can they find your book?
Oh, thank you so much. So I'm on Instagram, millennial on Instagram. So On Call Peds, On Call PEDS is my Instagram handle. And then my book is on Amazon and on my Etsy store. It's Beyond the Basics, a pediatrician's newborn guide. I tried to detail out as much as possible to make the journey as easy as possible for parents.
Awesome. Well, thank you very much for coming on. We're going to do this again real soon, I promise, because there's so much more we wanted to talk about. So. But
Thank you so much. Have a good day.
You too. We'll talk to you soon. Okay, so like we kind of teased, being a healthy mom means being a healthy eater. So we have got a chef. Look, guys, we had obstetricians, pediatricians, women who birthed obstetricians, and now we've got a chef to talk to you about healthy eating. So we want to welcome Chef Sunny to the show. Thank you very much for joining us.
Thank you so much for having me.
Thank
I'm
you
so
for
happy
bringing
to be here.
Exactly. She brought the food, so you know she's a keeper. Okay, so we asked her to make 3 simple meals: 1 breakfast, 1 lunch, 1 dinner. So what did you bring us first for, and these are meals that anybody can make.
Simple,
Yes.
easy to
Even
make.
busy moms. So what did you bring us for breakfast?
All of these are 30-minute meals or less. So for breakfast, we have brown sugar oatmeal with honey oats and yogurt. We also have a berry medley with strawberries and blueberries. And I threw a few grapes in there for pleasure.
Nice. Now I'll tell you, this is great for pregnant women
See,
and
he took it from me.
and breastfeeding moms because oats. We talked about those healthy carbs. Oats. We've got berries, antioxidants, super important for development of the baby's brain, central nervous system, and to keep all of the cells healthy. So that is an amazing breakfast.
Delicious.
Oh man,
I feel like a healthy mama.
I was gonna say, it's almost worth getting pregnant over.
What?
Yeah. We're gonna make television
Your
history
food
here.
was that good, like-
Television history here, yeah, exactly. Food's so good, men are willing to get pregnant for it now.
All right, let's go to lunch.
Okay, so for lunch, we have two different options. Quick and easy, both of them. We have grilled chicken salad.
Healthy proteins, those healthy proteins we were talking about.
Yes, so we have spinach with cucumbers, tomatoes, yellow bell peppers. The dressing is a light oil-based dressing with different herbs, lemon juice, a dash of honey, just for a little sweetness, not too much. And then the chicken breast grilled. This one is grilled chicken breast over jasmine rice and a spinach salad with boiled eggs.
Now the spinach is super important because of the iron.
Yes.
Most pregnant women, most breastfeeding moms, anemic. Iron helps to combat that. Healthy protein there. Now this is, what is it, salmon?
So this one is salmon,
Okay.
broccoli, and sweet potatoes.
Okay, now the salmon's super important because it's got a lot of those healthy fatty acids.
DHA, omega
DHA, I was gonna say, these fatty acids help the baby's brain to develop properly. And
I can feel it.
yeah,
I can feel it, yeah.
he's getting
Developing,
smarter.
I'm getting
He's getting smarter, Chef Sonny. Okay, awesome. And then of course broccoli, it's got a lot of the important vitamins that you need both for a healthy pregnancy and when you're breastfeeding. Now, dinner time. Dinner time is the one that I think people struggle with the most because the day just kind of gets by you before you know it. So we have, what do we have for dinner? This is, oh no, I think the salmon was the,
So
oh no.
the salmon was for dinner.
salmon was for
These
dinner.
two
Yeah, yeah,
options
yeah, yeah.
is for lunch.
Oh,
So-
okay.
So this is the second lunch option. This is also
Yep.
chicken?
Yep, this one is chicken, grilled
jasmine
chicken
rice.
over
Oh,
jasmine
this-
rice.
Okay, gotcha. And the eggs, super important. Healthy proteins. Nice, okay.
I was about to go caveman. I'm gonna pick the whole thing up and
I
trying
know.
to. I'm just gonna do a caveman style.
So tell people, where can they find you?
You guys can find me on Instagram. My name is Chef Sunny Chicago on Instagram. And my website is www.sunnyhays.com. I offer catering services, private chef services, meal preps.
I was gonna say the meal prep, especially for like pregnant women,
Meal
new
preps are
moms.
amazing for pregnant women and
Yeah.
new moms. It decreases the amount of work that you have to do after you have the baby. You just grab the food and go.
Somebody babies you while you baby your baby.
You know, you need somebody to cater to you while you
There you
cater
go.
to the baby.
That's right.
And I'm here for all of that. So check out my website.
And let me tell you, I'm having this. I'm here for it. Check out our website.
All right, thanks
Thank
for
you so
joining
much.
us. All right, guys. All right, so we had a pediatrician on who was telling you everything you need to know about bringing home that newborn, but the reality is that they don't stay newborns for
grow up.
long. They grow up, and just like most people are anxious about the thought of a newborn, they're more anxious about the thought of an adolescent or a teen. I know. So we have got an amazing pediatrician on to help give me some pointers for taking care of those adolescents and teens. He goes by Dr. Disney. He's an amazing follow on Instagram. I love this guy. He was actually supposed to fly in, and then he got sabotaged by the airline, so he's joining us remotely. But Dr. Disney, thank you for joining us.
Thank you so much for having me. I'm so excited to chat. I was hearing the groans about when we mentioned a teenager. What's that about?
I don't know, man. I don't know. No, I love my kids, but teenagers are very challenging. You know, they ask you questions you can't answer all the time. Like it's just, I don't know. Like I love my toddlers. I love my adult kids. The teens. I can do without those years.
I know. No, I'll tell you. I mean, I think that kids of all ages are fun, but the teenagers are a challenge. I
Yeah,
will
it's
say.
just like because and when they're smart and they ask you questions, you really it's like just because I said so. That's why.
Exactly.
Like, don't challenge me. I'm too tired to think. You know?
Well, let me ask you. So, I think that there are so many challenges when you have adolescents and teens. You almost wonder, where do you start? And so, My question for you would be this. When you're kind of looking at, the holistic well-being of your adolescents and your teens, especially when it comes to issues of mental health, because I feel like that's something that is becoming more and more of an issue, and that's something that a lot of parents feel very unsure of, right? Because mental health issues sometimes you can't see, whereas if a kid has a rash or a kid has a cold or a kid has a broken bone, it's very obvious. But when it comes to mental health issues, it's a little bit more challenging. So when it comes to kind of this holistic approach to a child's well-being, especially when we're talking about mental health issues, what do you as a pediatrician focus on most?
Yeah, it's a great question. And I like to remind all of us, because I think mental health is something that we all work with and deal with, that mental health sometimes can feel like something that's amorphous and out of reach. But really, mental health is a response to the world around us. And when I did residency, my very first rotation was in psych, and there were a lot of children and teenagers who came in, and I learned that about 90% of all child mental health is behavioral. It's affected by environment. Yes, there's some genetics and some predisposition based on your family history, but a lot of times it's our job as pediatricians to find out what's happening in this child's life. What is the mind telling us about the world around them? So what we do as pediatricians, I don't know if you had it in your training, we have something called the HEADS assessment. It's an acronym.
No.
And I love the HEADS assessment. Did you have it
We
when
did
you were
not.
in your training?
No. Or I forgot, but I don't think we had it.
No.
Well, I love it because we could use it with all patients, but as pediatricians, we have to do it with all of our teens. So it's the moment when we ask the parents to step out of the room when we talk to the child one-on-one, and we say, you are my patient. I'm here for you. So you go through the acronym and you're finding out things about home life. How do you feel at home? Do you feel safe at home? Like, do you guys spend time together as a family? E is education or employment. Do you feel safe at school? Are there bullies? Are you a bully? A is like activities, and this is the part where different pediatricians have different styles, but I like to ask, do any of your friends smoke or drink or use any drugs? And if they say yes, I say, okay, have they ever offered you? So I sort of like talk about the friends and how peer pressure is not always a bad thing. If you have good friends that can give you good peer pressure, but if you have bad friends, it can lead to some issues. D is depression, which is how has your mood been in the past 2 weeks on a scale of 1 through 10? What makes you feel crummy? Have you ever thought of wanting to hurt yourself? Have you ever hurt yourself? In what ways? Have you ever talked to someone about it? Do you want to talk to someone? And then S is sexuality. Are you interested in boys, girls, both, neither? Have you had sex before? Would you like to be tested for STIs? All those different things. And the reason I love that is because anyone can answer those questions and take sort of stock of themselves. But as a pediatrician, it's our job to see where is this child hurting. And what I find, especially after COVID, which hit all of us, especially in the medical field, I'm sure you guys agree, like it hit everyone so hard. And our teenagers were hit even more so to be out of school, to lose that social connection.
Yes.
And whenever I ask, like, how do you feel in the past 2 weeks? And they say like a 2 or a 3, and I say, how do you cope? A lot of them say that they just bottle it up. And I let them know that bottling it up is okay for a little bit, but your bottle can only fit so much, and eventually it's going to spill over. And so I ask things like, who do you talk to when you're sad? And that's when the tears start coming out, because they don't really have someone to share or to let the pressure off. And it's just building and mounting, and I think we'll talk about it later, but Riley from Inside Out sort of captured all of this in an incredible way, and that's why I think movies are both entertaining and educational for all of us to have these like macro level discussions, so we can all be in charge of our health.
I was going to say, I think for me, I've got 5 children, and I think that when you're a parent, okay, I've got to make sure they're clean, and fed, and go to school, and looking both ways crossing the street, and all of those things, right? But I think when it comes to supporting their mental health, I think as adults, like we're still struggling figuring out how to support our mental health, right? So what do you wish more parents knew when it comes to supporting their child's mental health and well-being that maybe they don't?
Yeah, this one is huge to unpack, again, because we can't really adjust every child's home and education and activities. The acronym, you can't really adjust everything, but what I want parents to know and what I love to talk about is the thing that you could do tonight and for the rest of the week and forever is the greatest therapy that your child will ever have is called dinner. The importance of having family dinner is paramount, because studies show that when you have just dinner once a week, the more that you have it, the better, but just one time a week, sitting down together, gives that child and yourself the space to decompress, to talk, to get things off your chest, to feel connected. And when you have family dinner, studies show that you as a grown-up, but even your children, have lower rates of anxiety and depression. Everyone's intellect goes up. You are closer together as a family. You rely on each other. So one story that breaks my heart is when I was in the clinic one time, I had this father come in with his two sons, and the father had to step out to like go change the car or something or put some money in the meter. And I asked them, I was like, oh, how many times a week? It's a standard question that I ask because I care about mental health and finding ways that we can, pick out info from the short interactions we have. And I said, how often do you all have family dinners? And they were like, what is that? And I was like, well, it's when you sit down together to share a meal. And they said, oh, no, we kind of just all sit in our own rooms, close the doors, and watch TV. And it's really hard because as a pediatrician, we never come from a place of judgment. You don't want to say, well, you're a bad parent because you did this or you didn't do that. And there are limitations and resources that affect all families. But if you're going to eat, I recommend that you eat together because that is such an important landmark and milestone and an anchor point for your children's mental health and overall health and yourself.
That's honestly, that's so profound because one thing I've noticed, like growing up, we always had
family dinner.
We had family dinner, and how was
Thank
your
your
day?
mom for that.
Yeah, no, my mom. Honestly, we did. And how was your day? And what did you do? And I mean, it was time to not just socialize and interact, but it provided an opportunity for you to have a safe space to say things. And now, even with my kids, sometimes it's so hard. Everybody's here's this room, that room, doors are closing, and I'm like, no,
And the funny thing was, at the time, like family dinner, I was like, oh God, please don't ask me about my day. I just lived my day. I don't want to discuss it again. But now I'm like, but that was a time when I knew like people care. Like people care. They're going to give me advice, and I still miss it. I'm almost 35, and I miss my family dinners.
30, please, you're almost 55.
So I let that pass. I let that get by.
Yeah. But actually, that's a beautiful segue because I think part of the reason that family dinner has begun to suffer is screen time. Everybody is on their devices and they don't want to peel themselves from their devices to sit down with the family. And so my question for you is this, because I know I took my son for his visit to the pediatrician recently, and the pediatrician asked me about screen time. How much time does your son spend on the device? And I'll be honest with you, I knew she was coming from a good place, but I almost felt a little bit guilty, like, oh well, too much time. Yeah, I'm like, too much, right? So how do you engage parents about screen time without maybe making them feel like they're being, judged?
Yeah. A lot of what I do comes from a place of education because I know I want to make informed choices. So everything that I say in the office visit is I'm here to just give you information and you are the parent who makes the decision. Screen time is not necessarily a bad thing because technology is a tool and you can abuse any tool. So when it comes to screen time, we have certain guidelines, which are when you're a child under the age of 2, there should be no screen time, again, because we want that child to practice communicating. So we want them to use their words. And the problem with screens, there are a lot of incredible creators out there. Miss Rachel, I don't know if you've heard of her, she's wonderful. A lot of that is one-way communication at a child. So they're not really getting the brain to have an impetus to talk back. And that's why we don't recommend it for certain age groups. And then past that, it's really a maximum of 1 to 2 hours per day. But I think even those guidelines, we have to be objective about it and say, kids are using screens in school, like they have them for homework and they have to use them to accomplish their own tasks. So what is the true guideline when it comes to screens? And I recommend that families just take stock of how much a child is using screens because screens, if they're being used in a way to replace something in their lives, then that's unhealthy. And we find that screen time, when it's most detrimental and it leads to a lot of mental health issues and comparing yourself with kids online and bullying, what it's doing is it's replacing something that they've lost, which is that connection, that family point, that friend point. Our kids, I always talk about in the room, and a lot of teenagers, when I ask them, what do you do for fun? They usually say, oh, nothing. And, it's very easy as a pediatrician to just document nothing. But I try to say, well, are you interested in any sports, instruments, arts? Do you want to learn any other languages? Like something somewhere. This isn't just a blank canvas in front of you. This is a child who hasn't learned to talk about interests. And when you find it, whether it's anime or something else, then you can help them work on finding their passions in life. But if they don't have another tool or another avenue to use their time, whether it's sports or whatever it is, then social media fills that connection. If they don't have family dinner or they're not eating with someone, then yeah, they will close the door and just watch TV because that's what you're role modeling as a parent. I think that's the other point too, where there's a lot of parents who, especially when it comes to talking about weight or healthy food choices. I remember one family, I was like, oh, we talked about, having no soda in the home. And they're like, yeah, she continues to drink soda. And they wanted to point at the child. And I said, sweetheart, I got you. And I was like, Mom and Dad, who's buying the soda? And then Mom was real quick to point at Dad. And Dad was like, but she told me to buy it. And the grown-ups are the ones who are building the home environment. And we have the responsibility for making it safe and supportive and connected for that child.
100%. So we're running short on time, but I just want to ask you, I love your social media, and I love how you use pop culture and storytelling and Disney stories to really connect with not just your patients, I would imagine, but with parents as well.
Yeah.
And when we were kind of corresponding back and forth, we were talking about the movie Inside Out, right? Which I saw was actually an amazing movie, and because it works on an adult level and a kid level, right? And in the movie, I'm sure everybody knows, but basically, the main character is this girl, Riley, and then she has all of these sub-characters in her head, which are her emotions, her joy, her fear, her sadness, her anger, and her disgust. And it shows how the interplay between these different emotions affects her emotions and her behavior. And what do you think that how do you think that people can use pop culture and movies like Disney and so on and so forth to understand their children and to relate to their children more effectively?
Yeah. Inside Out is one of the most incredible movies, and when I watched it initially as a child, I was a little confused by the message. I was thinking, wait, are they telling me to be sad? I don't want to be sad. I want to be joyful. So I didn't really like the movie initially, but upon rewatching it as a grown-up, they're talking about exactly what we addressed, which is you can bottle things up, but you need to release it, and sadness helps Riley and all of us release it. I think that one of the most important things that we could do, especially for our boys, is to give them the space to not feel like they have to man up or the only girls cry, because you're taught the only emotion you're allowed to show, which they also talked about in the movie, is anger. And so you feel like you can only show anger, and then we start to question when boys are acting out or being physically abusive, which is never approved, or we don't condone it, but you have to think, what is society telling us? What are the hidden messages? And Riley in the movie is affected by her environment because she has a world stressor, which is they moved. She's now in a new school. She thinks that her parents are arguing because of her. Again, the family's not making it a point to spend time with Riley. She feels like she's losing that connection, and what she's seeking in the movie is connection. That's why she wants to go back home and get back to what her normalcy felt like. And in terms of pop culture in general, Disney movies are great. Movies like The Joker are great too, because we could point at him and say he has mental health problems, but the whole movie's commenting about how society failed him, and that's his world stressor. And as a pediatrician, I love that, because all that we do is public health based and preventive health based, and you have to take care of the holistic person, from policy to programs to resources, to really change society.
Wow.
Well
I want to say this has been a phenomenal conversation. I feel like we say this every time, but I think we're going to have you come back because there's just so much more we wanted to talk about.
We're flying you out to Chicago. So
yes, for sure. But how can people find you? How can people find you? I think people already know he's Dr. Disney, but how can people find you?
Yeah, I'm Dr. Disney on all socials. I heard the previous person say on Instagram, but I also am on TikTok and YouTube, and I love connecting with people and hearing their stories as well, so please reach out.
Awesome.
Absolutely.
We're going to have to do this again real soon. Thank you for joining us.
Thank
And
you so
guys,
much.
we are almost done, but first, today's prescription TikTok.
There's quartz. I don't measure, so we're going to try to drink.
That's right, guys. Cheeing is believing. So cheers.
See what you did there. Chia
See what I
seeds.
did there?
Cheating is
Yeah,
believing.
yeah. I'm not going to quit my day job. Anyway, that's what you got to say. Don't quit your day job. Anyway, so chia seeds and water, everybody's doing it, and there are some health benefits. Chia has a lot of fiber. Fiber binds to sugar. Fiber binds to cholesterol, lowers your blood sugar. some great benefits. However, and also it's a prebiotic, so it increases the good gut bacteria, so that's a good thing. However, chia seeds, they are fiber, so they cause a little bit of GI upset.
Cause
so,
bloating, they cause gas.
Gas,
So like she said, chia seeds could lead to your glow up, but when it comes to your pants, chia seeds may lead to your blow up as well. You know, you got to make a decision. You know, 50% of this, half dozen of that, 6 of the other, whatever the case may be. Okay, guys, this episode is now done. But as always, as you make your way to the receptionist desk, please, what are you going to tell her? What are
they're
you
going
going
to
to
make an appointment for the next episode of Second Opinion with the Twin Doctors. I'm Dr. I.
I'm Dr. J. See you guys later.